Hello friends, in this video we are going to talk about the second part of the pelvic organs, that is the female reproductive system. Before we go into the details, let us see the parts of the female reproductive system. This is the labia majora, this is the labia minora. Here we have the bladder, the vagina, the cervix, and inside the bulb of vestibule. Then the mons pubis here on either side. Then we have the pubic symphysis. Then we have the inguinal canal along with the inferior epigastric artery. This is the round ligament of uterus, the fallopian tube, the fimbriae along with the ostium, not the ostium of the bone. This is different, ostium. So ostium of fallopian tube, and this is the ureter. So briefly the parts now. Now let us go into the details. First is ovary. First we'll talk about ovary. Now this is the location of ovary in the ovarian fossa. So we have the external iliac vessels, the external and internal iliac vessels along with the ureter, the medial, the superior vesical artery, the medial umbilical ligament along with the ovary. Now the relations of the ovary, the peritoneal relations. Here we have the ostium of the uterine tube, and this is the broad ligament of uterus, and the ovarian artery supplying the ovary, and this is the mesovarium lining, and this is the obliterated umbilical artery. We have seen this in the Hesselbach triangle also, obliterated umbilical artery. And this is the parietal peritoneum lining the ovarian fossa. Along with that we have the ureter and the internal iliac vessels. Next is the structure of ovary. So as we can see the structure here, this is corpus luteum, the albicans, the germinal epithelium here. This is the medulla, this is the cortex. Here we have the Graafian follicle, this is the oocyte, the secondary follicle and the primary follicle. These are the blood vessels along with the mesovarium. This is the secondary oocyte, and here we can see ovulation is happening. Coming to the blood supply, we have the ovarian artery, which is a branch of uterine artery. We have ovarian artery and the ovarian branch. We have the ovarian artery and a branch of the ovarian branch of the uterine artery. Now the venous drainage is same, but extra pampaniform plexus is very important. Even for the testis we have seen pampaniform plexus, same with the ovary. And the lymphatic drainage is the pre and para aortic lymph nodes. Nerve supply is T10, T11. Parasympathetic will be same S2 to S4. So T10, T11 is the sympathetic. Now applied anatomy we can see in per vaginal examination, pelvic organs in female, rectum and prostate gland in the male. Now the prolapse of ovaries, especially where we have the rectouterine pouch of Douglas, that's where the prolapse can happen. And the ovarian torsion due to the long suspensory ligament. So when we have a long suspensory ligament, the torsion can happen. Sometimes even cyst can also develop. We can see the cyst developing, which is basically present in the corpus luteum during pregnancy, causing antero-posterior bulging of abdomen, but the dullness is not affected. And this is different from ascites. Here shifting dullness will be present. And ovarian carcinoma, in the ovarian carcinoma 15% are the anatomic cancers, 20% are the gynecological cancers. And teratoma, formation of pluripotent cells in the ovary, that is called teratoma. Now the descendant of ovary, we can see this is the ligament of uterus and the ovary. So as the ovary is descending down, even the fallopian tube also is coming. Along with that, the two ligaments are forming a connection like this. Now coming to the development of ovary, here we can see it is developing from the sex cords. Here the sex cords or the medullary cords will be larger here. And then in the second generation they will shorten, forming into cell clusters. Here we'll have the cuboidal epithelium. At the last it will flatten. Okay, and here primordial follicles will be formed along with the degenerating medullary cords. And then they are replaced by the vascular stroma. And here the germinal epithelium also formed along with the meso and the paramesonephric duct. Now the histology. So in the histology we have first of all the cuboidal epithelium, the lining. Second one is the tunica albuginea. It even lines the testis, tunica albuginea. And third is the cortex. Here this third what we are seeing, cortex. The fourth is medulla. And the fifth is blood vessels. Here we have a number of blood vessels. Next, coming to fallopian tube. Coming to the different parts we have. This is the isthmus, the ampulla, the ampullary isthmic junction, the infundibulum and the fimbriae. Now the blood supply, arterial supply, it will be same as that of the ovary, where we had an ovarian branch of the uterine artery and the ovarian artery itself. Same will be the venous drainage. And lymphatic drainage is same as that of the ovary, where pre and para aortic lymph nodes are there. Nerve supply, it is supplied by T11L2. I repeat, T11L2. And tubectomy is a procedure where the fallopian tube is cut and tied at both ends, so that the ova cannot travel to the ampullary isthmic junction for fertilization. And this is also one method of family planning, just like vasectomy. Now the histology of the fallopian tube or the uterine tube, we can see a beautiful mucus layer which is thrown into a number of folds. So we have a number of folds with a lot of mucus layer. And also we have inner circular layer and outer longitudinal layer, very important. Basically muscle coat, second and third are basically muscle coat. And here we have serosa. So this part is the serosa. Right. Now coming to the uterus. So the uterus, we'll see the parts now. This is the uterine wall, the cavity, body, isthmus. The osses are very important, the internal and the external os, and the cervical canal. This is the cervix and vagina. And below we'll have the hymen, clitoris and all that. Now the relations. This is the rectouterine pouch of Douglas. That's the main thing to mention. This is the uterus, the vagina, the vestibule, and this is the peritoneum. That becomes the rectouterine pouch of Douglas, the rectum here, with the pelvic mesocolon. And here is the bladder with the urogenital diaphragm, the perineal body. Here fascia of Denonvillers will come. And this is pubocervical ligament. In the prostate gland, puboprostatic ligament. Please remember that point. This is the anterior abdominal wall. Now the different supports we can see here. So coming to the different supports, we have bladder, cervix and rectum. I'll give you a simple mnemonic, BCR. BCR as in bladder, cervix and rectum. So here we have the transverse cervical ligament, the uterosacral, the uterus and the sacrum. This is the pubic symphysis. and the pubocervical ligament. Here also we can see this pubocervical ligament. This is what it is. Okay, these are the supports. Now the blood supply, we have the intrinsic we have the intrinsic circulation of the uterus. So this is the uterine artery dividing into the arcuate arteries, then it is dividing into the radial arteries, and this is internal, the spiral artery and the basal artery. This is the intrinsic circulation. Now the lymphatic drainage, pre and para aortic, internal and external iliac, sacral, obturator and superficial inguinal lymph nodes. Nerve supply is the T12L2. Okay, T12L2. Now this is a prolapse of uterus. We can see that the uterus is supported by the perineal body and the levator ani on both sides attached to the obturator internal, obturator bone. And then what happens is in the prolapse, this support is broken. So there is a toning of the perineal body is torn. Then the uterus will fall off. Prolapse, it will fall off. We can see that. Now the histology, this is at the maturation phase. Then we have the proliferative phase. In the maturative phase, we have the tall columnar epithelium. Yes, we have the tall columnar epithelium here. This is the endometrium, the myometrium, muscle. Please remember, myo means muscle. So we'll have a number of muscle fibers over here. And that 4 which is there is the blood vessel. There we have a blood vessel. And here is the uterine glands. They will get mature, that uterine glands, and they will enlarge in the pregnancy. Got it? And that too is called as connective tissue. We can see some limited amount of connective tissue also. Now if we see the secretory phase, we can see the uterine glands here. The uterine glands will be enlarged. Rest of the features are common, like tall columnar epithelium, endometrium, here connective tissue, and we have the blood vessel and the myometrium, full one muscle layer totally. Now if we see the development, in the development we have the development from the uterine septum and the urogenital sinus. Here sino-vaginal bulb is formed and the uterine septum will disappear. Then we have the vaginal plate here developing into the vagina, hymen and the fornix. This is the development. For uterus and vagina, please write the same development. Got it? Now the developmental defects. We can say here, didelphate uterus with a septum. Septum is there and 2 uterus for 1 cervix. And here no septum, just bifid, 2 divisions. And this is bicornuate and unicornuate uterus. Bicornuate is 2 cornu. There are 2 cornu will be there in the uterus. Cornu is there in hyoid bone also. Please remember that that's a different cornu. This is a unicornuate uterus where only 1 cornu is associated with 1 cervix. Right, agenesis, there can be absence because of paramesonephric duct failure. An infantile uterus development will be very early and it is clinically an amenorrhea presentation. Alright, and okay, this is the thing. And then we have vagina. So vagina is nothing but the female organ of copulation forming the birth canal, part of the birth canal. Uterus is mainly the birth canal. Now what are the relations of the vagina? Here we can see the levator ani, the vagina, the cervix, and here the transverse cervical ligament, the uterine artery, the ureter, the pelvic fascia, and we have the urogenital diaphragm covered by the inferior fascia. and this is the bulb of vestibule and the pubic symphysis. Now coming to the blood supply. Blood supply, it will be supplied by the vaginal artery, just like ovarian artery and ovarian branch of uterine. Like that, vaginal branch of uterine also there. Then internal pudendal, middle rectal and inferior vesical artery. Now venous drainage is through the pampaniform plexus. Lymphatic drainage we have upper, middle and the lower 1/3 of the vagina. So upper 1/3 is the uterine artery into the internal and external iliac. Middle 1/3 is the internal iliac nodes. Lower 1/3 is the superficial inguinal nodes. Now the nerve supply, it is supplied by L1, L2. Just like our prostate gland, it is supplied by L1, L2. The upper 2/3 mainly. And now culdocentesis is a very important procedure in the applied anatomy. So it is a procedure where the needle is inserted into the vagina. How? Through the rectouterine pouch of Douglas for pus drainage. Just like we do myringotomy. Myringotomy, we take the otoscope inside the middle ear and remove the pus. Like that culdocentesis is. Just we are comparing a similarity. This is the histology of vagina. Here we can see the stratified squamous keratinized epithelium. This is the lamina propria. This is the blood vessel, the lymphoid follicle, and this 5 and 6 are the muscle layer. Muscle coat. We have the outer longitudinal and the inner circular layer. Then lastly, let us see with the external genitalia of the female. We have the vestibule, the mons pubis, labia majora and minora with the clitoris. So here I will tell what are the main points which we will have to remember. In the vestibule of vagina is present inside the labia minora. Okay, it has the urethral orifice. Basically, we have mainly the urethral and the paraurethral glands. Paraurethral glands of skin and the greater vestibular glands of Bartholin. And we have also the lesser vestibular glands. Coming to the mons pubis. Mons pubis is a layer of fat and skin united by the labia majora on the either side. It is just a cushion during the coitus interruptus. And the labia majora, as we said, just like our mons pubis, they are the folds of the hairy skin. There are some folds which are there that will form the mons pubis. Alright, and the labia minora. Labia minora is below the vagina, and there we have the vestibule of the vagina. And there is a fourchette also. Fourchette is connecting labia minora with the vaginal orifice. And clitoris. Clitoris is a small erectile structure just like the penis, but some differences we have to remember. This does not transmit urethra, clitoris. Got it? And just like the penis in structure, we don't have the corpus spongiosum. There is no corpus spongiosum in the clitoris. Corpora cavernosa will be there, but the corpus spongiosum, that is in the male, and this is continuous with the crux or crura. Got it? And instead of corpus spongiosum, we have the bulb of vestibule and the glands of the clitoris. This is important for sexual desire because there are some sensory receptors that are innervating. So that is basically going to create intense or increased sexual pleasure. So with this we end the female reproductive system, and we also finish all the pelvic organs. Now that brings us to the end of the video. So thank you so much. I will see you in the next video.